If there is a problem with medical devices, ventilators, and source of power, or if exposed to the dust, so if we cannot use a ventilation set, we must use a balloon mask. If the tracheostomy canal is not in place, application of Ambu Bag would keep the patient alive for a very long period of time. When ventilation with balloon mask is applied correctly, when applied to the face, there is no problem. There are masks of various size that is suitable for the age of the patient, and they ensure that patients safely reach the safe area where the devices are located. Ambu Bag actually has a very simple logic and has a tip that fits into tracheostomy canal or mask. It has a valve cap to release excess pressure. It has a stretchable bag. It is a reservoir bag that allows oxygen to accumulate. When we ventilate the patient with an empty Ambu Bag, even if there is no oxygen source, we send 21% of the oxygen in the room air to the lungs. But we can still have some benefit to the patient. However, what is ideal is to connect the Ambu to oxygen with an oxygen source, especially through a portable tube to see inflation of balloon, to feel a resistance in your hand, and make sure that you are giving enough oxygen to patient when you press it. During the treatment of the patient, you must have the appropriate size mask, Ambu Bag, tube and oxygen with you. First of all, we connect the balloon mask a reliable oxygen source. The important point here is that when we open it, a sound of oxygen will come and we will see our bag begins to inflate. When our bag swells in this way, oxygen accumulates in that bag. While we will give oxygen at a rate of 21 with an empty Ambu on condition, that we will fill this reservoir, we can give the patient 45%, even a higher rate of oxygen up to 60 or 70% if we press very properly. Therefore, we can transfer the patient to safe area in a healthy way. Ambu is connected to oxygen, your tubing is working, your reservoir is swollen. When you press the Ambu, you will deliver enough oxygen to the patient. If the patient tracheostomy cannula is in place and stable, you should connect the Ambu tip the tracheostomy cannula. If the tracheostomy cannula is not in place, you have to choose a mask suitable for the patient height, age, and face dimensions. Newborn masks are small and shown in pink. Children masks are yellow and blue. Becoming green and red they can become adults masks. This is an adult mask. The important thing here is that when you place it on the patient's chin, it must also include his nose. That is, the mask must cover the face completely. You give the patient head a slight natural position to place the mask. The nose is the upper part of the triangle and the chin is the lower part of the triangle. There is a current of air coming into my hand right now. When you feel the airflow, you know that the oxygen is enough. Our bag is already swollen. You will encounter resistance when you place it on the patient's face by making a C shape with your hand, and so that it takes his or her chin and nose. When you press, the excess pressure comes out of the wall, so you cannot apply too much pressure to the patient. In accordance with the patient's age and weight, we should press at least 20 or 25 times per minute for adults, 30 or 35 or more times for children, 40 and 45 times for newborns, at least 1/4 of the size of the bag. If your patient has a low saturation rate, you need to give more oxygen. As I said, there is a valve mechanism here. As you precise that the patient with the Ambu, the oxygen goes to patient, and when the pressure is too high, it goes out through the valve. During procedure, you must follow the pulse oximeter. Before starting the Ambu process, the patient's saturation is below 90. His or her color is purple, lips are purple, hands are cyanotic purple, and he or she is sweating, her respiratory muscles are pulled, and nasal flaring. That is a respiratory distress situation. When you start to use the Ambu Bag, if the patient's sweating decrease, after you put the head in the correct position with your hand, if the patient respiration decrease, if the nasal flaring decrease, the easiest thing is the alarm sound is silent. In the pulse oximeter and the saturation rise above to 19 or 92, then you are doing the right thing. You can safely evacuate the patient by breathing in this way for a quiet long time, as long as your oxygen supply is sufficient.